hopped off a call. If you guys have questions afterwards, I just hopped off a call involving the entire South Bay, all the Department of Social Services, senior housing units, and some nursing facilities were on the call. And so there's a lot of questions about some of the topics that we're going to hit today. So excited to get started when it's time. How do you want to do this?
So welcome, Dr. Lamb. Thank you so much for covering for Dr. Ayati. Dr. Ayati carried us through the first month in April, and then we decided to resume our town hall. So hi, everybody. I'm Palo Wolfson. I'm the manager of Avenidas Care Partners, and we're going to be coordinating these now monthly discussion groups. And Kat King is going to be helping us each month moderating this. And so right now, since the three of us haven't worked together before, you're kind of watching an improvisational team in real time here. So because we want to respect Dr. Lamb's time, I know that he's very busy and he's actually working in a local skilled rehab facility today, but he's taking time off to be with us. So Kat, is there a certain, would you like to kind of do your introduction to Avenidas, and then we'll throw it to Dr. Lamb?
Yeah, thank you. Let me find my introduction. Here we go. Good morning, everyone, and thank you for joining us. As Paula said, I'm Kat. I work with Avenidas, and I will be your moderator today. I also wanted to let you know that we are recording this session, and it will be available on our website afterward. Dr. Lamb, I wanted to introduce. Dr. Lamb is the chairman of geriatric medicine at the Palo Alto Medical Foundation and on staff at Webster House in Palo Alto. We also have Paula Wolfson with us, is the manager of the Avenidas Care Partners program, which provides multiple counseling and supportive services to our local community and to long-distant relatives. Paula is facilitating multiple support groups by Zoom and managing a crisis intervention and consult line during this pandemic. Both Dr. Lamb and Paula will be around to answer any questions you have after the presentation. We currently have you all on mute, so you can feel free to put any questions that you have in the chat, and we should be able to get to them once the presentation finishes. Depending on time allowance, we may also allow you to unmute yourselves to ask questions as well. Dr. Lamb may leave us before the town hall finishes, as Paula said, but Paula will remain to answer any questions that you have. And without further delay, I will hand things over to Dr. Lamb so he can get his presentation underway. Oh, there we go.
Great. And do you have the slides pulled up? Can everyone see them?
I do. Hold on.
Okay, great. Yeah, I just wanted to take a few moments to express my thanks to Avenidas and all the great things that they've been doing during this time. I think that many of you have enjoyed their on-site services for many years, if not decades. And we just wanted to let you know that they are busy at work even during this pandemic, and they definitely have been making an impact on getting things like PPE out there for high-risk elder communities, places that if they did not have the PPE, we would not be able to really prevent the major outbreaks, the spread that we had seen in other communities across the nation. So needless to say, their support has been instrumental in our county. We've distributed supplies to gosh, I think it's about 70 different elder care congregate living communities in this area. And, you know, to be honest, I think it's made a huge impact. So really appreciate your continued support for Avenidas and their programs. I see the slides are up, and so let's go ahead and move forward. So, you know, I was asked to talk about flu season and COVID-19, and, you know, Dr. Ayati had, I think, probably a fantastic presentation prepared. I will try to do my best as a fill-in. and get you good information. And I want to give credit to Lily Horng, who's a colleague actually out of Stanford, who's now serving at the state level, leading their flu task force. And so the slides that you're going to see are hers, and really I have had to do very little editing. They've just really put together a great set of information, and I'm happy to go through it with you today. So let's go ahead and go to the next slide. Oh, do I control this? No, I do not. Kat, can you move forward?
I have it. Do you need me to move forward again?
Yes, please.
Okay.
So hopefully by the end of this talk, you'll know more about the flu. Maybe you already know a lot, and this will reinforce some information that you know. And then we'll talk about it as it relates to COVID-19 and where we are now as a nation and as a state. I don't know if I don't see it moving forward. Okay, so I'll go ahead and talk about the next slide while you try to move forward.
Move forward again?
You know, I'm only seeing. Maybe it's just my screen, but I only still see the first slide. So
hold on one moment. Okay,
so,
let me try sharing one more time. It might.
So I think, Dr. Lamb, if you have capacity to share your screen, you might want to take control. That might be easier than telling Kat to move ahead. Are you able? Are you able to do that, Dr. Lamb?
Yeah, I might be able to. Let me see.
Let me see if this works a little bit better. Can you see that?
Yeah.
Okay, there we go. All right, so we jumped up.
The plane is flying. Okay.
All right, very good. This is the world we live in now, folks. You know, I'll be honest with you. I've become actually more patient with technological snafus than I was before. So let's go to the slide number 2. Flu vaccines are critical. It's interesting because you're going to hear more about flu this season than you ever have before. And this is on the heels of hearing about 6 months of really deep science, medicine information. This is a level of information overload that the world has not seen before. But you're going to hear more, and it's going to be about flu vaccines and why they're critical. So the reason why that is so important is because there's significant overlap in the types of symptoms that you will see in the flu, and we've all had the flu before, and COVID-19. And that overlap combined with just the incredible contagiousness of COVID-19, as you'll see in the next slides, really makes difficulty in making proper diagnosis and really honestly threatens to overwhelm, is a threat to overwhelm our healthcare system. So flu vaccination is a key part of making sure that does not happen, that the healthcare system continues to function well for those who need it. And people can be infected by both the flu and COVID-19. So I know there are a lot of questions about that. So flu vaccination can help really make it possible for those who have COVID-19 to get the care they need and prevent the rest of us from really having to be in that sort of healthcare system. You know, obviously we don't want to get sick either, and there are ways to prevent that. So let's go to the next slide. And, you know, you can see that, and if you haven't heard it, you know, COVID-19, the pandemic continues. And how long it will continue, nobody really knows. Now, nobody's really said this, but when we look at COVID-19, which is known as SARS-CoV-2, there actually was a SARS-CoV-1, and that was largely contained in southern China and Hong Kong. Some of it went out to Taiwan, Singapore, and Canada. There were small blips. And that was SARS in 2002 to 2004. Now, you notice I said that it was 2002 to 2004. It actually took about, I guess, those almost 2 full years to really peter out. Now, we didn't have the sort of worldwide pandemic that we do now. It didn't upend our economy, although it did upend local economies where it affected, but it really wasn't a pandemic. It was a localized epidemic. And this is different. And so we have a lot of research that's going into things like vaccines and ways to mitigate this. So maybe it won't last that long, who knows? But it's just sort of something to think about is what happened in the past. And we see that the positive cases continue to rise. That's just how statistics work. As more people start to open up, as they feel more comfortable going into restaurants, it seems like that might be a particular hotspot. People tend to let their guard down, and positive cases continue to rise. Now, for the healthcare system, what we look at is not just, how can we get good education out and how can we prevent the spread, but also the volume of care that's being sought out and how many people are in our ERs, in our ICUs, on ventilators. And that capacity continues to be available. And it's thanks to the good work of you, all of you on the line here today. All your friends and neighbors that are masking, social distancing, washing your hands frequently, and being just very aware of not just the effect that people can have on you, but the effect that you can have on other people. Go next slide, please. The next slides will move a little bit more quickly. Influenza burden, even without coronavirus, you can see that it affects so many people, up to 56 million. It results in up to 26 million medical visits, which is quite a bit. And there is a significant number of, or I should say there are a significant number of hospitalizations, as you can see on the slide here. For those of you on the phone, basically it's under 1 million hospitalizations and around up to 62,000 flu deaths. And I believe that's in America. Next slide. And what you'll see on this slide is quite interesting. I don't know if you can see it well, but you'll see that the flu spikes every year. You see this sort of rhythmic increase around around winter into spring, and then it plummets during the summer months, and then it goes up and down, up and down. And you'll see we had a particularly vigorous season back in 2017, 2018. And then you'll see the curve widening. So there's what seemed like a prolonged flu season last year in 2018, 2019. And then last year, end of the year, what you see is a little bit different than what you saw in the previous years. And that's not just a widening of the curve, but it's sort of an unusual widening and increase in the number of cases of this is influenza-like illness. And if you guessed that might be because there's overlap of coronavirus, you would be right. And those influenza-like illnesses, things that we might have been calling influenza and reporting through our health departments, actually probably were related to coronavirus. Next. Basically influenza and influenza and coronavirus are from two different virus families. Next slide. The transmission is similar. They can both be spread by respiratory droplets. That's why we mask. That's why we stay 6 feet apart. Contact with objects is less common, but still possible. And so that's why we wash our hands so frequently. And it turns out that our hands are a great or terrible way of us, getting viruses because we oftentimes touch our face with our hands. Incubation for the flu is usually 1 to 4 days, and coronavirus average 5 days. It's hard not to miss the 14-day thing that is always on the news, but essentially you can continue to spread it for, most people can continue to spread it for up to 14 days if they're healthy. If they're not healthy and they're immunocompromised, say they have cancer, they're on chronic high-dose steroids, they may actually end up being contagious for 20 days. So just realize that there's some variability there. Go ahead, next slide. Flu, okay, yeah, flu and COVID-19 symptoms are similar. You have your cough, you have your fever, your chills, muscle, body aches. You could have diarrhea. The one thing that seems to be different is that, you may have heard that with coronavirus, many people will have a loss of taste, and that is not something that we would expect with flu. Next. Now, a reminder that up to 40% of people that have coronavirus or had coronavirus actually reported no symptoms at all. So they had no idea at all that they were infected or infectious. And that's part of the story about why coronavirus has been so terribly effective at reaching everyone in the world. Next. So who's at high risk for severe illness? Actually, the same people who are at risk for severe flu are the same people who we are really concerned about for coronavirus, and that's older adults. Those are people with underlying medical conditions like diabetes and pregnant women. Children actually are at higher risk for severe flu than severe COVID-19, but there is a very, very serious syndrome that actually has been noted in several, I believe the case study is between 100 to 200 children. It was just published, I think, in the past month about multi-system inflammatory syndrome. And it's just a reminder that children are not immune to coronavirus, no matter what you might hear elsewhere. So co-infection is possible. So you might actually get two at the same time, and that is not a picture that we want to see. So next slide. Vaccination saves lives. Now, a lot of times you'll hear, and honestly, we'll say, "Gosh, I got the flu vaccine, and then I got the flu." And how did that happen? Well, it turns out that flu vaccination is actually a team sport. There's a little bit of prediction involved. Not every single strain of the flu is put into the flu vaccine. But what we believe and project to be the most likely strains, or maybe the most serious strains that are going to be prominent, are the ones that we try to manufacture into the flu vaccine every year. So the flu vaccine, if you don't know, actually changes for every year. Last year, the 2018 to 2019 flu vaccine was actually estimated to be about 29% effective. Now, some of you will say, wow, that's great. Some of you will say, gosh, that's really not very many at all. So basically, the thing to think about is that the virus strains that are contained in it, it is preventing you from either getting severe disease or getting a flu at all by getting the vaccine. But again, there may be other circulating strains. Overall, 29% is quite good on a population-wide basis, and everybody is doing their part by getting their flu vaccine, preventing an estimated 58,000 hospitalization and 3,500 deaths. Next. So these are the current guidelines, and this is from the, it's the ACIP, it's the immunization, basically it's a panel, it's a national panel that meets, and these are their recommendations for the year. Go ahead next. So go to the next slide. So who should get the flu vaccine? High priority patients and caregivers. That is largely the folks that make up Avenidas is a fantastic member population. Next. And what is the best flu vaccine? Now, this is actually, something that is pretty, we're going to dive in a little bit deeper than I usually would. But I know that there are a lot of people who have different sorts of allergies, and I just want to be able to sort of, or concerns about live versus inactivated virus. And I just wanted to use these slides to set a good foundation for us. So there are both egg-based vaccines and non-egg-based vaccines or egg-free vaccines. And the reason why we do that is egg-based vaccines are actually quite effective. It is a very effective, cost-effective way of developing vaccines. But some people have egg allergies, severe egg allergies. And for those people, they really need an alternative. And those are what the non-egg-based influenza vaccines are for. So you'll notice these abbreviations on the next slide. The IIV means inactivated. An inactivated virus is not capable of causing contagious flu or contagious disease. It might cause you some of the reactions, maybe a low-grade fever, maybe a little bit of muscle ache, maybe localized, maybe brief and generalized. But in general, it's not going to spread. Okay, it's not capable of spreading. Live attenuated virus, they take out certain parts of the virus or inactivate, or not inactivate, they take out certain parts of the virus that make it not possible to replicate or to be contagious. And those are your live attenuated virus. However, that is not 100% of the case of the time. And so you'll notice that for older adults, we actually do not recommend live attenuated viruses for any older adults. And you'll see that in the next slide. What we recommend and what you should be getting is an inactivated influenza vaccine. And for those people who cannot take the egg-based, the two options are the cell culture inactivated and the recombinant vaccines. So go to the next slide. That'll help explain. This is just a little bit more detail for those of you who want to know what is in the 2020 to 2021 vaccine. These are the exact strains that you'll find in there. You'll notice that there isn't 100% overlap between the non-egg-based and the egg-based. So you'll get a little bit different coverage. But the ones that are similar are the Hong Kong H3N2, the Washington Victoria lineage, and the Phuket Yamagata lineage viruses. The one that is different is the first one. The egg-based has the Guangdong Maonan H1N1 virus, and the non-egg-based has a Hawaii H1N1 virus. So next slide. And this is really, what you should be getting as a vaccine. So I want you to move your eyes all the way to the right side of this slide. You'll see that last column is greater than 65 years of age. And so you'll notice that there are these three that are recommended, Fluad quadrivalent, and Fluad high dose quadrivalent. All three of these are egg-based, okay? And all of them are inactivated. Okay, so you don't have to worry about getting a live attenuated virus. Now, if you have an egg allergy, if you recall, there are two options for you. Those two options are on the rows above those three. So you see the recombinant, it says RIIV4, I believe, and then the CCIIV4 vaccines, and those are non-egg based. Go ahead, next. So, who shouldn't get the flu vaccine? If you have severe life-threatening allergies to the flu vaccine or any ingredient, you should not be getting the live attenuated vaccine. So the next slide. If you have egg allergies, we already covered that. But they have egg-free vaccines. So next slide. Some people with a history of Guillain-Barre, which is a rare neurological disorder, within 6 weeks of the previous dose of influenza vaccines should be careful. You should be, that's a discussion between you and your healthcare provider about whether or not you should get the flu vaccine. If you do not know if you had Guillain-Barre, then you did not have Guillain-Barre. And then there's this, question about temporary deferral. Should we actually, if you have a moderate or severe acute illness, should you temporarily defer? And the answer is it's susceptible. You can wait until you recover from that, 10, 14 days, and then get the vaccine afterward. and also for coronavirus. So next. Flu vaccinations are starting now. I know at the Palo Alto Medical Foundation, where I work and see patients at, that we are getting our vaccines in, I believe what I heard was the next 1 to 2 weeks. So definitely call your provider. We are set up to keep people safe for vaccines. We've learned an incredible amount about how to do that well in the past 6 months with coronavirus. So please do not be afraid to call and make that appointment with us or with any healthcare provider that you normally see. And this is where to best vaccinate. I mean, to be honest, we are just blessed with an incredible amount of expertise in this area. I mean, we have fantastic medical facilities and capabilities from Stanford and Palo Alto Medical Foundation. So, you know, and independent physicians that are affiliated with both. So please feel free to do not be scared of to vaccinate, and do not be scared because of coronavirus. There's just, I'll actually go over this. This is a good one. There is one that I intended to skip, and I think I already took it out. But this, you know, what can you do to be safe? I mean, we are really have quite a bit of knowledge about how to prevent spread of illness. We probably do a better job now than we ever did before. And in that way, we hope that this is the lightest flu season we have had on record. Time will tell. But what you can do is you can physically distance greater than 6 feet apart. We have many healthcare facilities have those standing stickers on the floor, so you can know how far to stand, and face coverings. Some people will even use goggles or face shields. Next slide. And that's all I have. So I'm going to answer one of the, okay. So Paula, Paula wrote a question here. What is our best practice for covering our coughs? Okay, great question. Normally, what we would consider to be the professional way to cover a cough is actually to cough into your elbow, okay? And that was before coronavirus. Now with coronavirus, we should all actually be having face coverings. If you want to augment by covering with your elbow, you can. I just would not necessarily hold it snugly against your face covering. Generally, the outside of the face covering is something we consider dirty. And you know, I would just follow those precautions. Sneezes, same thing. We should be wearing face masks when we're around people. I know it's very unusual. These are unusual times, and for the time being, until, you know, who knows when this the coronavirus is over, we'll probably be living in that reality.
There was a question in the chat, excuse me. Donna says that she got her last flu vaccine in March, and she was wanting to know if she can get the one for this season, or if she should wait a period of time.
Yeah, that's a great question. You can absolutely get and should get the flu vaccine. It's a different flu vaccine than what you received in March, and it is predictive. It's based on the predictions on what they believe are the more severe strains or the more likely to be prevalent strains. So absolutely schedule your appointment to get your flu vaccine.
Awesome.
I have another question that Paula sent me. I'll go ahead and answer that one. Any difference between obtaining a flu shot at an area pharmacy or one's provider? Is there a specific flu vaccine for those 65 and over? So great question. You can, I mean, anywhere that will give the flu vaccines, will give one of the ones that you saw on the previous slide. I don't know if you can pull up that one slide with the columns showing age greater than age 65, but those are the flu vaccines. There are 3 of them that are recommended for folks over age 65. And so you will get one of those 3.
Oh.
Other questions? I don't know if we can allow people to unmute, but I do know
I can
that.
go ahead and do that. And
Yeah. So sometimes it's hard, I know, to type in your questions. So if you wanted to try to unmute and then mute afterward.
So everyone should be able to unmute themselves. Please feel free to ask Dr. Lam or Paula a question if you have anything that's on your mind.
What would be good? You know, everybody, we're a very small group for a town hall, so we can really benefit. We can unmute, and you can show yourself, and that way you can raise your hand to us, and then we can call on you that way. So, Kat, I don't know if that's under your control, that you can allow them to be seen. And
they can turn on their own video, I think.
Okay.
I don't think I control any of that.
So for those of you who are willing to be seen, and a lot of you know each other, I can see everybody who's on here, and we're a small group, and a lot of you are already Avenidas members. You're in my caregiver groups. There's a lot of you I do know. So it'd be great if you come onto the screen, and then you can raise your hands if you have any questions.
I have a question, if I may.
Okay, Veronica.
Yeah, I'm interested to know, what are the differences of the 3 vaccines for seniors over 65?
Yeah, there's only one major difference that I can see, and that is with the high dose quadrivalent. Technically, based on what the state provided about the flu vaccines this year, they should be covering those 4 strains that I had shown on that one slide. Instead, what you see is, that first one has 3 strains. The second one has 4 strains. That's why it's called quadrivalent. And that third one, the flu zone high dose quadrivalent, is actually a higher dose. And the reason why, just to give a little bit of explanation there, the reason why they have the high dose is because we know that in older folks that you may actually, your immune system may actually need more of a dose in order to have a longer lasting effect. So sort of a more prolonged immunity. And that's something that I don't think we fully appreciate, and we've been recognizing more and more over the past, I would say, 4 or 5 years.
Well, isn't all the quadrivalent, aren't they all having 4 versus there used to be one was a 3? Yeah,
I'm seeing, and that's what I'm seeing here. Is that one of the slides that I presented said that there are 4 strains, but what I'm seeing here, and I don't have the specifics, is that the first one listed under greater than 65. Do you see that one? It's called Fluad. That one apparently.
We're not seeing that. We're not seeing that screen.
Okay.
I stopped sharing, so let me go ahead and share it again. Just give me one moment.
So that one, when you look at it, it has this sort of like more technical name. It's adjuvanted AIIV3.
Which slide was it?
It's slide 17.
Let me see if I can.
Now the good question, one good question is, gosh, should I try to ask for the one that has 4 versus the one that has 3? I guess if you had a choice, I would choose the one that had 4. I can't really say. I mean, most of the time with my older adults, I would like to give the high dose vaccination just to make sure that it's that it stimulates the correct immune response. But just recognize that if you get the high dose one, it may actually result in more prominent symptoms as well. You may get the same sort of protection from a lower dose of vaccine. So we really don't know. It's different from person to person. There's no way to predict. Yeah.
So it looks like none of them this year are the trivalent or the 3, right?
You know, it may be, and I have to look this up, but my guess would be that one that is marked adjuvanted AIIV3, that 3 may refer to it only having 3 strains.
Mm.
Oh.
Thank
Yeah.
you.
Yeah, it doesn't have the tri in there at all. So everything else
Yeah.
is quadrivalent except for that one. So
Great question. Thank you.
were there any other slides you want me to revisit?
No, that should be fine. And we'll see what other questions folks have. And just
Yeah.
recognize, folks, that this is a new era. I have never seen more celebrities in pajamas in my life. So please do not be shy. Although this is recorded, so you may want to.
I do have I have many questions because I think all of you know I run these groups and then I hear the questions from the people in my groups. And so one of the questions is each year we're told to get, once we're 65, to get a certain set of annual exams and tests done and also injections. So shingles injections, and then there's another one, a pneumovax
or PCV, yeah.
Okay. Can you talk a little bit about the efficacy and doing all that at once? Should we do it kind of spread out over a few weeks?
You know, that's a fantastic question. And to be quite frank, I'd have to look that up to give you the, I think what is the most up-to-date answer. Previously, we would just give vaccines, you know, as many as we could at once. There's no reason why you wouldn't be able to. And especially in the time of coronavirus, I would question the net sort of benefit of having to schedule multiple visits or multiple sort of exposures rather than one. Okay. So I you know, my sort of opinion, my medical opinion would at this time would be to get as many as you could at once. Yeah. So if you turned age 65 this year, and is, you know, obviously flu season, if you could, you know, if you needed to get your pneumococcal vaccine, if you needed to get your flu vaccine, if you needed to get your Zostavax, I would get as many as possible at once. But I do need to get back to you and make sure that there is no adverse effect of having all 3 at the same time.
I'm going to put in my 2 cents worth, if it's okay, if I'm not taking up too much time.
Please.
All I know is with animals and giving them vaccines, and we're not talking about flu vaccines, that there have been problems in giving too many vaccines at one time to animals, that some of them get severe reactions. Mm-hmm. So that's, you know, for me is a sign that maybe with people it could be the same thing.
Yeah, and that's something, I mean, I don't want to, first of all, I wouldn't want to give you advice without giving you the most recent information. So I will look that up and get back to Paula and Kat after this.
I do know that I had this conversation with a Kaiser physician, and I know Kaiser, you can go into Kaiser in the lobby and get in line and get the flu vaccine. And then to do the other 2, I think you have to go to their infusion center. At least the one I know about is in Redwood City. So then you're waiting in the infusion center. But at the time I had this discussion, the physician did not make any distinction about doing it at once or doing it over a period of time. It was really about convenience to the consumer or the patient. So I think that would be interesting to hear what you do find from a research point of view.
Yeah, and the reason why I say that is because a lot changes. You know, I mean, we've seen our world change in a short period of time, and I just want to make sure that you know, that the most recent data is still supportive of that sort of approach.
Okay. Does anybody have any other questions? Because Dr. Lamb had invited us to hear about his discussion he had prior to coming on to this, which I think may be very relevant to a lot of people about, Dr. Lamb was at, with the Departments of Social Services about senior housing and assisted memory care and those protocols.
Yeah, so I guess is your question about sort of what that discussion was about? Yeah, it's actually really interesting and tragic in the same way is that we're having to put into place emergency preparedness plans because of the fires. And we've seen this before. I know not too long ago, a couple of years ago, we actually ended up getting patients. I don't know if it was from Paradise or one of those fires, and they had to evacuate residents from those senior areas into our area. And so the same sort of thing. There are wildfires that are, you know, not contained, risking, you know, large populations. And the question is, now that we have to contend with coronavirus, how do we evacuate people safely? And so the state has put into motion two sort of plans. One is that these town halls are going to be convened by the Department of Social Services with their residential care facilities for the elderly. And that's going to be on a regular basis. You can look up on their website of what the details of that are. And that was a town hall meeting that I was on. And then the second one is that they've actually given the local health, not given, I should say they've delineated, clarified, made clear that the local health department, when there is a COVID-19 case, takes jurisdiction over that care. And so there's coordination is I think, evidence of coordination, which is, I think, reassuring.
That's interesting. Thank you for sharing. Any other questions from anyone? This is where it's hard to see if you want to do them on the chat.
Yeah, don't have any other new questions on the chat, but please don't be shy if you have any comments, any questions. It doesn't have to just be a question. You're here to discuss anything. So
I have a question for the folks on the line. I'd love to hear from you. Is there anybody here who is not going to get their flu vaccine this season?
So that Kat, if people want to unvideo, you know, are you in control of the video, Kat? Or
no, I'm not. No, they can. Feel free to jump into the video if you would like. Feel free to unmute yourself and jump into the conversation. We're totally open here. Hello, Veronica.
Hi. Yeah, I'm planning to get a flu vaccine, though I never have gotten the quadrivalent. I always asked for the low dose one. It's been recommended by a physician friend for that. So that's why I was interested, and hopefully there's still the low dose option for me.
Yeah, just to be clear, the trivalent and the quadrivalent would both be considered low dose. The high dose option is available for the quadrivalent.
Yes.
Yeah.
Hello, Ralph and Robert as well. Glad that you are joining us today.
Hi, Robert. It's great to see you.
Yeah, unfortunately, my video is not working, so I can't.
Oh, we can see you.
No, we can see you.
Okay, I can't
Bob,
see.
you were on live.
And I didn't even know it.
You have a stream-worthy background.
Yeah, I think what came up and so Bob and some of the people on here in my Monday caregiver group, and one of the things we were talking about previously were, is there anywhere where there's a drive-in flu set up? And I think we are starting to see that in other parts of the country, but I haven't heard about it here. And if anybody does, let us know?
That question also goes in with what Beverly asked, if Palo Alto Medical Foundation might make use of their outside courtyard for giving flu shots.
Yeah, you know, the answer that I can give is that we actually are very well set up because of our experience with coronavirus to deliver flu shots in sort of those outdoor settings. But we moved everything indoors about 2.5 weeks ago because of the fires. With the weather turning cooler, it's unclear whether or not we will go back to being outside or not.
Yeah.
But if there are sort of drive-through flu vaccine clinics, you know, obviously from a reputable provider, I would not hesitate to use that as an option.
That was kind of in line with something that I was thinking about. One of the things that I wanted to mention was when I listened to the voice messages every day, there was one, I think it was last week sometime, someone was asking if we were doing our flu shot clinic, and we are not. Avenidas won't be doing that this season. But when I was having a conversation with her, it became clear that it was going to be a little bit more difficult for her to find a place where she could get the flu shot, probably mostly because of the coronavirus pandemic. Have you seen that that's a trend? Do you see that it's affecting things, affecting the availability, the ability for people to get that?
Yeah, that's a fantastic question, and I have not seen any interruptions or disruptions in availability. So everything that I've heard is that that the number of orders that have been placed are expected to be filled. I have not heard of a flu vaccine shortage, neither locally nor nationally.
That's good.
Yeah.
Has anyone obtained a flu shot here on University Avenue and CVS or the pharmacies downtown? I think they started.
Bob, I took my partner, my wife, to CVS at Town and Country, and it was very quick, very efficient. It was an easy way to get it done.
Great.
Okay. So,
Ralph, did you have a question?
I just have a comment. I had heard that I should put off getting the flu shot till a little later because of the relatively short-term effectiveness of it. I've always gotten my flu shot at CVS on Middlefield Road. So the other day I was picking up a medication and they wanted me to go ahead and get the flu shot. So I said, okay. And I did, and they gave me a flu shot. And it was kind of a rush. And I didn't find out and couldn't tell from the paperwork they gave me whether it was the high dose or not. Mm-hmm. And I know the chart that Dr. Lamb just put up, I was searching around to find the paperwork to see if it matched the description on that chart, and I couldn't find it. So I still don't know whether I got the high dose or not. And I reported it back to Stanford, where I get my health care, just so they know that I got my flu shot. But every year previously, I've always gotten the higher senior dose. Mm. This year, I still don't know what dose they gave me. So anyway, I just wanted to kind of report that that's where it stands.
Is that probably the difference between getting it at your providers where they know you, they've got your records, and you know, when you get in line and they pull you up, they know your age, versus I think going to a pharmacy. I think that may be a difference.
Possibly. Yeah, but in the past, it's been far easier to get it at the pharmacy. They have my record. It is recorded. They have I get all my meds there.
Can't you call the pharmacy and ask them? They should have a record.
I probably could, and I will do that. Anyway, thank you.
Yeah, I think Veronica's suggestion is how I would go as well. I would call them and they can look up your record. They absolutely will know which type of vaccine they gave you. That way you'll have that for your record.
Assuming it's not high dose, do we get a quote booster?
No, no, I would not rush to get a booster. If you've gotten vaccinated, then all three of those vaccines are approved for greater than age 65. And I would not rush to get more.
Thank you. This is helpful. So Dr. Lam, I do live in a multi-generational household, and I have, I think, one or two people I know of who have do not believe in getting vaccines. They're very strongly opinionated about many things, including vaccines. So how does one navigate that? Is there any strategies for discussion to perhaps change their minds?
Yeah, I mean, I think so. It used to be generations past that you just did what people, the Surgeon General or what, the physician, the medical team was asking you to do. And I think that for good reason, I think that there's been a lot of sort of questioning and sort of more active patient engagement in their health. And I think that's a healthy thing. I do think that one of the things that we recognize is that people have certain fears. Some of them are based on misconceptions. Some of them are based on things that are not even related to health. They may feel wronged or maligned in some way. And this is a way of sort of expressing that, that injury or hurt. What I would say, and it certainly isn't necessarily something that I would expect anyone to be able to maybe be successful at on their own, but certainly as a member of society, I think is fair and healthy to ask where that's coming from and what the concerns are, and if those concerns can be addressed by the medical community, I think that would be a huge plus.
Thank you. Okay. Other questions in the chat?
This is Donna.
Hi, Donna.
Okay,
Yeah.
wasn't sure it was coming through.
Yeah.
More of a comment. I have a number of friends who have children who are not letting them do anything, basically staying home, and they even hesitate to go to the doctors at all. So if there's a possibility of drive-through, I think you'll get a lot more people, seniors going possibly, than if you actually have to go out. I mean, a lot of those people would never walk through CVS to get to the pharmacy to do that, to get their flu shot. So the way to do it with the least amount of contact would probably make more seniors actually get the flu shot.
That's great input. And what I will do is I can actually send an email to my colleagues who are involved in that effort. That's a great bit of feedback. I would say that, at any of the major healthcare providers in our area, we're just blessed. I mean, we have really strong medical teams everywhere. I mean, you look north, south, east, or west, you've got people who know what they're doing. And so the clinics are really are set up for minimal sort of entry, minimal exposure. And the heart of it is you shouldn't get sick by visiting the doctor.
Okay. I do have a question about folks with dementia, Alzheimer's, and cognitive decline during the season and getting shots and all these injections. Is this happening in the assisted and memory care places, or do they have to? I know in a skilled rehab, you can obviously get that, but in the non-skilled custodial care communities, physically, does that person have to be taken out to then get their shots and their vaccines?
I'm sorry, can you restate that question?
So among my caregiver groups, we have a lot of people whose loved ones are in assisted and memory care, boarding care facilities. So how do they access vaccines and shots? Is it the private doctor comes in, or they have to be taken to their providers?
Yeah, most of those people will go to their providers.
Okay.
Yeah.
Okay, well, Dr. Lamb, this was so helpful. We appreciate so much your coming on board. I just want to share with everybody that Dr. Lamb and I have both worked in this area for many years, but we really didn't meet until we joined forces over a program he started with a group of physicians called Operation PPE, Personal Protection Equipment. They were getting large donations on their own of equipment through their good graces among themselves and bringing it into this area, but they needed storage. So Avenidas closed March 13th, our doors, and then eventually I was called, but I think it was Dr. Ayati who said, can we store at Avenidas? And so there's a bit of protocol and talking to the board and talking to team leadership, and they said yes. So that allowed me to then to meet more geriatricians at one time that I've met in my 30-year career, which has been wonderful. So now we're partnering, and upstairs, I'm at Avenidas right now. Upstairs, we have a room full of masks and face shields and gloves and sanitizers and things that our volunteers are packing up through Jillian Halberton, who's our volunteer coordinator. And it's allowing us to stay viable to the community in these ways, and also to team with Dr. Lamb, Dr. Ayati, Marina Martin, the section chief of Stanford Geriatric Medicine, Peter Chang, Dr. Husan. So it's been an amazing relationship, Dr. Lamb, and this is just the start of perhaps more working together in different ways. So thank you so much for being here today.
Yeah, you're so very welcome. I do have to jump off, but I just want to thank Avenidas for all of their support. You guys have been a pillar in the community for a long time, and we definitely want to get your name out there so people can continue to support the great work you guys do. And thank you all to the folks actually that attended today. I really appreciate your interest in this area.
Thank you.
Thank you.
Thanks so much.
I'm going to stay on for anybody who really wants to stay on and have a conversation about anything going on for you this week. I do run support groups and we have time left. So, but this would then involve either you're being willing to show up on video or unmute, and I can run this as a group. So I'm just going to give it a few minutes. And if you want to stay, stay. If you want to leave, thank you so much. So
I can also stop recording if you would like me to.
Yeah, I think stop recording is will make all of us feel